All right, I think we have everyone here. Well, good afternoon. Thank you all for attending this media briefing today. We are here to discuss and provide one of our bi-weekly COVID-19 updates, along with some information with respect to vaccination rollout in the Northwest Territories. Today we have here Premier Carolyn Cochrane. We have Health and Social Services Minister Julie Green. We also have on the line Chief Public Health Officer Dr. Candola and Brigadier General Pat Carpentier with Joint Task Force North. So again, I will just ask all media to make sure they have their microphones muted, and please only unmute them when you are called upon for questions later on in this event. I would like to now turn it over to Premier Cochrane to deliver her opening remarks. Premier.
Thank you, Andrew. And good afternoon, everyone. Thank you all for taking the time to join with us today. With me on this virtual meeting briefing are Minister Julie Green, Minister of Health and Social Services, Dr. Candola, Chief Public Health Officer for the Northwest Territories, and today we bring Brigadier General Patrick Carpentier, Commander of the Joint Task Force North. So a year ago, many of us were planning for the holidays, time to celebrate with friends and family, reflect on the year that was and the year that we planned to have as the calendar turned over into 2020. Little did we know at that time that across the Pacific Ocean, across the world, the first known cases of what would become known as COVID-19 were being discovered. And in the following months, the world around us would change. 9 months to this day, the World Health Organization declared the COVID-19 pandemic. And for the last 9 months, we've asked you all to make sacrifices that no government wants to ask of its residents. We've asked you to keep safe distance from people around you, like our loved ones and our friends. We've asked you to limit social gatherings and to avoid public spaces as much as possible. Many of you were asked to work from home, while others lost their employment altogether due to an unprecedented economic shutdown across Canada and the world. The COVID-19 pandemic has threatened our health, impacted our economic well-being, and disconnected us from the social support networks that we rely on for most of our lives. And it put to test our mental health as we tried best to navigate the uncharted.
Yeah, I can't hear her though.
As we tried best to navigate the uncharted waters of the modern day pandemic. COVID-19 put to test the resiliency of Northerners in a way that we've never experienced before. In Canada, provinces and territories, we grappled in the early days with how best to contain the spread of the virus. All jurisdictions took immediate steps to protect the health and well-being of residents. Our government, NWT government, responded to the orders of the Chief Public Health Officer and made protecting the health and well-being of our residents and our communities our top priority. To date, it's worked. As we've seen in the last few days with the wastewater surveillance, helping to identify 5 cases from residents in Yellowknife who were self-isolating and were following the rules. Residents in the NWT have been safe. Our communities have not experienced the loss of life as a result of this virus. And our biggest risks are being managed while we've watched the number of COVID-19 cases across Canada explode in the last 6 weeks, especially. We can't do this alone, though. And to everyone who's been following the public health orders, a sincere thank you. I also want to take time to thank Canada for their commitment to supporting the NWT and its unique needs during this pandemic. A strong relationship that we've built has played an important role as we've been able to secure an additional $30.7 million just last week to cover the cost of our pandemic services that have helped keep residents safe. So where to next? The global scientific community has been engaged in an unprecedented effort to develop a vaccine for COVID-19. And as we now know, they've succeeded. As Prime Minister Justin Trudeau announced yesterday, vaccination distribution will begin to happen in the near future. It's been a long and a difficult road to get to this day, but it's been our commitment to evidence-based decision-making and listening to the advice of our medical professionals and those in the scientific community that allows us to be on the cusp of beginning to overcome one of the biggest challenges our society has ever faced. Minister Green and other speakers today will provide more details on this. It's an exciting time, knowing that we're getting close to what might be the end of the pandemic. But the most important thing we all have to remember is it's not over yet. We've come so far, and we can't let our guard down. We need to continue to be vigilant in following the Chief Public Health Officer orders until residents are vaccinated. We need to keep our distance, wear our masks, wash our hands, and continue to protect the communities from the virus. I know this is going to be difficult for everyone during the holiday season. We all want to spend time with our family, with our friends, and embrace those we love dearly. But I ask that you continue to make the sacrifice we've asked of you 9 months ago. We're so close. As Northerners, we are resilient, and we will find ways to stay connected to our loved ones safely during the holiday season. As the season nears, it's also important that we find time to take care of our own and others' mental health and their well-being. One of the lasting legacies of COVID-19 will be how we treated each other, and I continue to encourage each of you to show compassion, kindness, and empathy. I now want to turn it over to Minister Green to provide more details on the vaccination plan. Thank you, everyone, for being here again.
I think we're just having some technical difficulties here, folks. If you don't mind hanging tight with us, please. Thanks.
I'm right at the top.
Did you hear that? How about now?
Yes, we can hear you.
Okay, good afternoon, everyone. Today is an exciting and long anticipated day in the territory because following a meeting with our federal counterparts, I'm pleased to confirm that the Northwest Territories expects to receive enough of the Moderna COVID-19 vaccine for 75% of NWT adult residents. Through 2021, we expect to receive enough vaccine to vaccinate everyone who wants it. And that said, I know that residents are anxious to confirm who will be a priority in the first round, along with how and when it will be delivered. Work is well underway confirming this detail for immunization in each NWT community. The vaccination plan will factor in the unique geography and population of the territory, along with recommendations from the National Advisory Committee on Immunization. But before this plan is finalized, essential information and collaboration is required. First, we need to wait for Health Canada to authorize the use of the Moderna vaccine in Canada. We don't expect this to take long. This is a 2-dose vaccine with the second dose delivered about a month after the first dose. 2 doses are required to make the vaccine fully effective. Second, we need to know from our federal colleagues exactly when the first allotted amount of vaccine will arrive in the territory. Delivery is expected between January and March of 2021. Third, we need to engage with Indigenous and community governments who will inform decision-making for vaccine prioritization. Engagement is a critical part of respecting residents and developing a well-rounded and collaborative approach. In the meantime, we're preparing for the vaccine's arrival. We're establishing vaccine teams made up of nurses and support staff. These teams will travel to communities to help local health care professionals deliver the vaccine to residents. We're also ensuring registered nurses receive specialized COVID-19 vaccine training. We're identifying data management for vaccine documentation and second dose coordination. We're also determining which reporting will be required to meet Public Health Canada, Public Health Agency of Canada requirements. We're coordinating with the federal government for the delivery of supplies such as needles, syringes, alcohol swabs, and personal protective equipment to be used during immunization. Supplies have been set aside specifically for the NWT and will arrive before we receive our first vaccine shipments. 2 specialized freezers are on their way from the federal government with enough capacity to store the entire territory's vaccine. These freezers will be installed at Stanton Territorial Hospital and Inuvik Regional Hospital pharmacies to be properly monitored. Portable freezers have been ordered to assist with shipping vaccine to the communities. Specialists from the Department of Health and Social Services and health authorities are working closely with the Public Health Agency of Canada's National Operations Centre to coordinate delivery of the vaccine to the Northwest Territories. Planning is underway to safely transport the vaccine within the North. This is just some of the critical work happening behind the scenes to prepare the NWT for the vaccination rollout. In the coming weeks, we will collaborate with Indigenous and community governments, federal government colleagues, health authorities, and Joint Task Force North to finalize our plan. I'd like to thank everyone involved with this life-saving work, and I look forward to sharing this detailed plan with you in the very near future. I would also like to take a moment to thank the residents of the Northwest Territories for the sacrifices that they've made to protect our communities and themselves from COVID-19, and sacrifices they will continue to make. The vaccine does not mean self-isolation requirements and travel restrictions will be lifted immediately. Vaccine uptake and decreased rates of COVID-19 infection will be necessary in the NWT and the rest of Canada before we can travel easily. But this vaccine does bring us one step closer to resuming the lives we had before the pandemic. Finally, I want to touch on a topic that is top of mind for some residents as COVID-19 cases surge in Alberta. I want to assure you that urgent and emergent care for NWT residents is not impacted at this time. We are considered identical to Alberta residents when it comes to the need for care. That means an Alberta patient will not be prioritized over an NWT resident when their care needs are equally urgent. The current service reduction in Alberta Health Services is to non-urgent visits and procedures. This reduction is happening across the country in areas where COVID-19 cases are at record highs. Practitioners are also using and promoting virtual care as much as possible to reduce travel to southern jurisdictions. NWT health system officials will continue to work with colleagues at Alberta Health Services and the federal government to mitigate any potential impacts on the health care of NWT residents. I would now like to introduce Brigadier General Patrick Carpentier from Joint Task Force North to provide a brief overview of the support they have provided the GNWT to help us finalize and implement our immunization plan. Thank you.
Task Force North is pleased to be able to support the government of Northwest Territories' plan to deliver COVID-19 vaccine. Joint Task Force North is collaborating with the government of Northwest Territories to facilitate logistical operational planning of the distribution of COVID-19 vaccine. Currently, planning support is being provided to the Department of Health in their work to bring the vaccine to the people of the Northwest Territories efficiently, safely, and as safely as possible. As a good partner, Joint Task Force North is ready to assist wherever and whenever the government needs us to help residents of the Northwest Territories. Thank you.
last, we have Dr. Candola.
Thank you. This is a turning point in the pandemic for our territory and for our nation. What happens around the corner counts on health professionals, our allies in the military, and leaders across our territory in delivering a mass vaccination campaign like no other in history. In preparing for the rollout in the coming weeks and months, I want to assure everyone that vaccines go through a rigorous review process before receiving Health Canada approval, and no steps will be missed at the expense of vaccine safety or quality. The Moderna vaccine is next in line in Canada's regulatory approvals. We will be ready to deliver that vaccine to 75% of residents 18 years of age and older in the first 3 months of 2021. We are currently finalizing our complex and ambitious vaccine distribution strategy. Our priorities will be guided by 4 key factors. We will prioritize those at risk of severe disease and those at high risk of bringing COVID-19 back in the territory. We'll also consider key populations recommended by the National Advisory Committee on Immunization. We will also listen to perspectives from Indigenous and community governments. Engagement is set to begin as soon as next week. Building trust and confidence across our territory will be vital to ensuring an equitable rollout. And we will recognize the unique geography and population of our territory. This will influence vaccine delivery. So it's more important than ever that we lead in lockstep and speak with one voice. That work begins now. Once we receive Health Canada approval, Northerners can feel confident that this vaccine is safe. Canada has a rigorous regulatory system that ensures vaccines are safe, effective, and of high quality before they're approved. All vaccines are scrutinized by the top experts, scientists, and medical professionals in our country prior to approval. More than 30,000 people have participated in the phase 3 clinical trial for the Moderna vaccine. At most, reported side effects have been mild to moderate: fatigue, joint and muscle pain, redness and pain at injection site. Side effects have been slightly higher with the second dose. While we expect approval for the Moderna vaccine to come very soon, vaccination will not begin until it stands up to this rigorous approval process. Moderna reports that its vaccine is highly effective. They indicate the vaccine is 94.5% effective in preventing COVID-19 illness. And of the 11 vaccinated participants who did develop COVID-19, none of them experienced serious COVID illness. To put this in perspective, the annual influenza vaccine is generally between 50 to 60% effective, but still provides high value for population health response. So while we work towards the light at the end of the tunnel offered by mass vaccination, Northerners should expect our current public health measures to remain in place. With infectious diseases, it's all about population level protection. This means we need to see increased vaccination levels and decreased risk of infection, not just in our territory, but across the country, before I can start reviewing public health orders. Until we reach that point, I'm asking residents to hold on just a little bit longer. Even after vaccination begins, we still need to keep up with the healthy habits that have worked so well up until this point. Physical distancing, masking up when required, washing our hands frequently, keeping our circles small, staying home when we're sick, and self-isolating or self-monitoring as advised. At this point, it's still not known whether vaccinated individuals can still pass on the virus, even if they are protected. We will also need to keep following self-isolation protocols and travel restrictions that help keep our territory safe. And especially as we move into a holiday travel surge, please continue to get tested at the first sign of any COVID-19 symptoms. In fact, testing is easier and faster than ever for more communities than ever. We now have point-of-care testing devices in Hay River, Fort Smith, Norman Wells, Bay Choco, and Fort Simpson. And these can give preliminary results in just 15 minutes. And we have more on the way for other communities in the coming weeks. By making these sacrifices for a few more months and supporting each other in getting vaccinated, we can make the sacrifices of the last year really matter. And with your help, your cooperation, and your trust, we will move even closer to a world without COVID-19 restrictions. Thank you.
Thank you, Dr. Candola. We will move to the question and answer portion of our briefing here today. As I had mentioned previously, Commander Carpentier does need to leave for a previous engagement that was scheduled. So I would like to turn the question and answer over to the commander and have media ask a couple questions at this time. Simon Whitehouse from News North, you said you had a question for the commander?
I guess I just had the one, but I think that should be directed to the CPHO, as you were saying.
Yeah, do you have any other questions for him?
No, that was it for right now.
If there are no other media that would like to ask questions, oh, sorry, we have Thomas Ethier from Radio Taiga. He would like to ask a question in French. Commander, would that be okay with you? Okay, Thomas, go ahead. Thomas, are you there? I think you might still be on mute. Okay, sorry, Thomas, we can't hear you, so I'm going to have to move on. We have a question for the commander from John Last at CBC. John, we can't hear you. Okay, sorry, John, we're gonna have to move on if your technology is not working. If there are no other questions for the commander, if you do have follow-ups, you can reach out to his communication staff. I've provided that information. So, Commander, if you would like to sign off, you're more than free to do so.
All right, thank you very much to everyone.
Like was said earlier, my PA staff is here.
Thank you very much for the Mr. Berry, Dr. Candola. Thank you very much for having me today. I'm sorry for the word.
Great, thank you so much. All right, well, we will turn it over to the question and answer, other portion of the question and answer period. First up, we have Emily Blake with Cabin Radio. I would ask that you just let us know who you're directing your question to, please.
All Are any of the microphones working? Can you hear us?
We can hear you, John. Emily, you're saying you can't be heard. Just 1 second. We're having some technical difficulties, so please bear with us. John, do you want to try and ask a question, please, since your mic seems to be working, and we'll work on a solution to the problem here.
Sure. Yeah, you can hear me? You're good?
Yes, we can.
Okay. Just a first question would be, can we get a total number for the amount of doses that the territory is expecting to receive in spring 2021 at this point?
I can answer that question. Can you hear me, John?
Yep.
So the total number of doses to vaccinate 75% of the adult population 18 and older will be around 51,600 doses. And that is for 2 doses. So you need to divide by 2 for the number of individuals.
Okay, great. And just as a follow-up to that, can you outline whether or not the vaccine will be made mandatory for anyone in the NWT, frontline workers or frequent travelers, anything like that?
We will not be making the mandatory, not the vaccine mandatory. We are waiting for the vaccine to be approved by Health Canada, and with the National Advisory Committee on Immunization, they will release a vaccine statement. So we would inform the public. We will inform the public about safety, but no one can be forced to take the vaccine. They will be provided information to help them make an informed decision.
Thank you, Dr. Candola. I'm going to try to ask some questions that have been provided in the chat. First one I have here is from Emily Blake at Cabin Radio. Looking at the question, I believe it would be directed to you, Dr. Candola. Will the 2 freezers be extra cold freezers capable of reaching minus 80 degrees Celsius?
The 2 freezers for the Moderna vaccine would only need to be required to be at minus 20. The Pfizer vaccine that was recently approved requires the minus 70 or ultra cold freezers, but we are opting to have a whole allotment be the Moderna vaccine, and that only requires a minus 20 degree Celsius freezer.
Great, thank you. And I have a follow-up from Emily for you as well, Dr. Candola. Says you referenced the government's vaccine approval regime. Does the territory have any plans or education to combat potential vaccine fears?
Excellent question. Vaccine hesitancy is a common problem. It's something that we see increasingly. People are asking for more information. We actually held a vaccine hesitancy workshop in early 2020. What we will be doing is providing material specifically addressed for people who are hesitant about taking the vaccine. And it's a full spectrum. People are hesitant for various reasons. And so we need to be addressing that population, answering their concerns, discussing any of their fears, and providing them with the tools and with the information they need to help them make a decision.
Thank you, Dr. Candola. Next question I have is from Bailey at True North FM. And he asks, does 75% of people being immunized mean the NWT will have herd immunity?
And that's another excellent question. So with modeling, you only would need about 70% of the population to achieve herd immunity. 75%, to have enough vaccine to vaccinate 75% of the adult population is excellent. But we have to realize that it's not just about NWT. We need to see the rates of COVID-19 transmission decreased across Canada, because we have a lot of travelers coming in from the southern provinces, and for the 7 provinces, they're not getting their full allotment in the first quarter. They're getting about 10% of their allotment, and so they will still need to be vaccinating more of the population quarter 2 up until end of 2021 to achieve herd immunity. So even though specific to NWT, we may significantly decrease our risk for local transmission or diseases, we're all in it together, and we need to know what's happening the rest of Canada as well.
Thank you, Dr. Candola. We have a question from Luke Carroll at CKLB. I believe this question would be for Minister Green, but if it's not, I believe Dr. Candola. The question is, with the storage freezers being located in Yellowknife and Inuvik, does this mean residents from those 2 communities will be the first to receive vaccinations? And are there any details available for plans to distribute vaccines to remote communities? Minister Green?
I can answer that if Minister Green is.
Sure, Dr. Candola.
So the vaccines will be shipped to the Northwest Territories, and there are 2 areas where we can store vaccines safely at -20, and that's Inuvik and at in Yellowknife. We've been doing this for decades with the influenza vaccine, so this is not a new approach. It's just a holding base where we store the vaccine, make sure that they're frozen, we don't break the cold chain, and that's a launching spot to go into the other communities. So it doesn't necessarily mean just because the vaccines got shipped to Inuvik and Yellowknife that they would be the first ones to receive and distribute the vaccine in their own community. It's just a holding spot.
Thank you, Dr. Candola. Next question we have from Simon Whitehouse at News North is, do we have Pfizer vaccines in town, or is it all going to be Moderna?
Excellent question, Simon. The full allotment of that 51,600 doses of vaccine will be Moderna, and that applies to Northwest Territories. And also Yukon and Nunavut have opted for the same option. The Moderna vaccine can be stored at -20. It doesn't require that ultra cold freezer. And so the challenging logistics we would have had by having only the Pfizer vaccine, we don't have to experience with the Moderna. In addition, with the Pfizer vaccine, we would have had vaccine come through Yellowknife and only be able to initially distribute within Yellowknife. So in terms of decreasing our logistic challenges for equity and just for the ease of administration into other communities, we decided to have a full allotment be the Moderna vaccine. However, both Moderna vaccine and Pfizer vaccine are the same vaccine type, messenger RNA. So you're not changing the type of vaccine. It's just a lot simpler to store and distribute in the Northwest Territories.
Thank you, Dr. Candola. Question from CBC, John Last is, he's asking Dr. Candola if you're saying that achieving the 75% vaccination rate will not allow the territory to lift travel restrictions or move forward a phase in the Emerging Wisely plan.
All these, first of all, we will be, don't know how many doses or the timing of shipments, but what we do know between January and March, we are rolling out a mass immunization plan, campaign. And there's so much more to know before we can lift travel restrictions. What we do know for sure is that the rest of the provinces are experiencing widespread outbreaks. They are only getting 10%, about 10% of their allotment. And so we're going to still have many visitors coming through the Northwest Territories who may not necessarily be vaccinated and still need to isolate. And you also have to realize that both the Moderna and Pfizer vaccine are targeted towards adults. For Moderna vaccine, it's been studied in 18 years and older. So we still have significant school-age populations that would be immunized. And with those two factors and the additional factor, we still don't know if I get vaccinated, I know from the Moderna phase 3 trials that it significantly reduces my ability to get the disease. But it's unclear whether I can still get the COVID virus infection and transmit it to other people, even if I don't get sick with it. So there's still a lot to know. So it's still early days to decide what we're going to do with the travel restrictions or what we're going to do with the phases, but we're going to continue to monitor the information and the evidence and make decisions accordingly.
Thank you, Dr. Candola. We have a question from Bailey at True North FM. I saw Yukon also announced they would be receiving the Moderna vaccine around the same time as the Northwest Territories. Could this mean the opening of a travel bubble with the territories again?
There's so many exciting possibilities with the arrival of the vaccine, but we just have to see how much vaccine we get, how quickly we get it, how we can quickly we can immunize our population right across the territories, and then we can make those decisions based on our progress. But it's too early to say anything now. But there are lots of interesting possibilities by having the incredible privilege to have all 3 territories receive their vaccine allotments in the first quarter. And I just want to take a moment and to thank the federal government and the provincial governments for recognizing the northernness and remoteness of all 3 territories and understanding our health system and our challenges, and to give us that incredible gift of achieving all our vaccines in the first quarter. So once we all receive that and we can go forward on mass immunization campaigns, there's lots of possibilities, but too early to state right now. Thank you.
Dr. Candola, we have another question from Luke Carroll at CKLB. Said, I believe Dr. Candola mentioned how workers who risk bringing COVID into the territory will be prioritized to receive the vaccine. And he's just wondering what specific workers you would be referring to.
So we are consulting with communities and we're consulting with Indigenous governments, and we have different priority groups. And so we still have to work out those level of details. And once we have, we will be informing the public, informing the media.
Thank you very much. We have a question from Simon Whitehouse at News North. Do you have any updated projections on what you expect the holidays will be like for people contracting COVID?
Thank you very much. What we will see a surge in travelers coming in. 2 categories that I've noticed is travelers coming in to reunite with loved family members over the holiday period, and workers coming in, essential workers coming in to cover for NWT workers who are taking their holidays. So that's all occurring up until the New Year's time period. And we've been watching those numbers come in, reviewing them and approving them. And yes, we'll anticipate a surge, but not as high as the summer. It's the message the Premier and myself have been saying that to avoid non-essential travel, especially coming in and going out, that seems to be heard. And we'll know the true numbers we passed the holiday periods, and we can go back and say how many people actually came. But it's been, the plans have been good. People are presenting good self-isolation plans. The workers are necessary workers. They are covering our own workers so we can take a holiday, take a break, take a staycation. So we're grateful for that. And that seems to be managed well. What I do see as of concern is I see a significant number of NWT residents who are leaving the territories and then coming back the first week of January. They will be required to isolate for 2 weeks, but when you look at getting close to 7,000 cases daily across Canada, and you look at how many cases there are in Alberta, active cases, and looking at the restrictions across Canada, is the one sacrifice I would ask people is reconsider your plans to vacation out of the territory. If we truly want to keep NWT safe and make it to the time when we can roll out this vaccine program, the first quarter, the less people travel out and less people travel in, the safer we're going to be. Thank you.
Thank you, Dr. Candola. We have another question from John, particularly about Indigenous and community government engagement that needs to happen with respect to our vaccination rollout. He was wondering what the expected timelines for those consultations and finalizing the list of priority populations would be.
So it was just yesterday that the first ministers had their meeting, and we're quite comfortable with the territories receiving their full allocation of doses in Q1. So that occurred yesterday. And at the same time, as soon as we heard that information, we booked a meeting with the Indigenous governments for next Thursday, and then meeting with the NWT Association for Communities and the municipal governments for Friday morning next week. None of them had meetings booked that time. We asked for special meetings because time is of essence, and we need to hear from our Indigenous communities. We need to hear from our mayors. We need to hear their feedback before we develop any formal vaccination plan or rollout. And this will occur shortly after these meetings.
Thanks, Dr. Candola. We have a question from Paul Bickford at the Hay River Hub. Dr. Candola, can you comment on the December 8th COVID case in Newfoundland? Workers from the NWT, is there any concern in the NWT?
Thank you very much. So there was a December 8th worker in NWT that was found to be COVID positive in Newfoundland, and we did investigate. What we can say specifically about that worker was not infectious in the Northwest Territories. The person developed symptoms many days after he returned back to his home community and was tested positive. So in terms of that particular worker affecting people in the NWT, the timeline was too long. But we are investigating that scenario, investigating the case to make sure that his exposure did not occur while he was working in Northwest Territories, and his exposure occurred while he was traveling. So that's still underway. When we wrap it up, we'll let people know. Thank you for the question, Paul.
Thanks, Dr. Candola. Do we have any more questions from media? I'd just like you to provide those questions in the chat box on the side of the screen due to the technical difficulties we're having with microphones. I guess while we're waiting, maybe we can have Minister Green elaborate on some of the work that needs to go on with respect to engaging with Indigenous and community governments over the coming weeks as we prepare for a vaccine rollout.
Yeah, thanks. Can you hear me?
we can.
Okay. This is Dr. Candola's initiation, so I think that she can speak to it better than I can. Thank you.
Thank you, Minister Green. So throughout this pandemic, from the day one in March, we've had regular meetings with Indigenous governments, particularly when we're about to do a new order, if there's a new development. And a vaccine rollout is a very exciting development, and it spells hope. It is a light at the end of the tunnel. And this is not a decision that needs to be made lightly, especially if we may not get enough doses to vaccinate the entire population, let's say in January. We have to start prioritizing. When you're looking at prioritizing, it's not just the public health expert who has to have a say. It's the people who are going to be most impacted. It's the people at highest risk. And so right away, when we heard news about this, the meetings were booked because this has to be a collaboration, has to be a partnership, it has to be co-created. And I'm extremely interested in hearing the feedback of the Indigenous governments. I'm interested in hearing the feedback from their mayors, because that feedback is going to help me prioritize within the prioritization. And it will be a dialogue. I can provide the 4 key principal factors that would put some people at higher risk, and they can provide their perspective on who would be at higher risk and how the vaccine should be rolled out, and even how it should be communicated, what their communication needs are. So these meetings will happen. It will be a dialogue. It will be 2 ways. And then after those 2 meetings, we'll then put out a formal vaccination plan, but we can't do it ahead of the game.
Thank you, Dr. Kandola. I'm not seeing any more questions from media at this point, so I have asked for a last call for questions. If we don't have any more, I would ask that you reach out to us for any follow-up questions or to schedule any interviews you may like. So I'd like to take this time to thank you all for attending today and for bearing with us with our technical difficulties. As you can imagine, it's not always easy running a media briefing online, but we appreciate your patience and your involvement today. I'd like to thank Premier Cochrane, Minister Green, Dr. Candola, and Brigadier General Pat Carpentier for attending today. And everyone have a great rest of your Friday and a great weekend.
Thank you, Andrew.
Thank you, Andrea. And once again, thanks to all the media for helping us spread the message. Thank you.